Local pediatricians are giving us a look at the good, the bad, and what's coming our way when it comes to RSV.
Yeah, they're hoping that families listen since they're expecting more kids to get sick over the next couple of weeks. Our Anusha Roy joins us in studio now. So Anusha, you talked with doctors from two major children's hospitals.
Yeah, I've been chatting with them over the last week or so from Rocky Mountain Children's Hospital and Children's Hospital, Colorado. They tell me they're expecting RSV cases to go up in the coming weeks. Children saw a sharp spike in the last 2 weeks. That could be somewhat due to holiday travel. Doctors from both places said right now they're still seeing more kids coming in sick as well. They're really expecting that to stay that way for at least a couple of weeks. There is a little bit of good news though. Children say while the numbers have hit the same level as 2021, they have not hit the same peak as last year. Those numbers were even higher, and it was so stressful for families and healthcare workers. Another positive trend this year was last year, Rocky Mountain Children's Hospital saw a lot of kids ages 2 to 5 falling very sick. That's a lot older than they typically see with RSV, but this year the age of their patients is way down. Dr. Danielle Dhaliwal is hoping that this really is meaning that some kids are building up more immunity after the pandemic lockdowns.
I think we've seen a little bit more of universal exposure, families, parents getting exposed, the older kids getting exposed. And now we're seeing the younger babies that haven't had that exposure.
So here is what to look for in case you need to go to the emergency room. That includes fast breathing, rapid breathing using abdominal muscles, babies that might be sleeping more than usual. So definitely don't be afraid to rely on those pediatrician and the nursing lines to help you out. And also know that COVID is circulating along with the flu, but not to the same level as RSV, according to Children's, especially for the kids.
Yeah, we don't mess around when it comes to RSV, Anusha, especially after what we saw happen last year.
Yes, 100%. And I think that's where a little bit of the silver lining is here, but the doctors really don't want people to let their guard down because they're still seeing kids coming in and needing to be admitted because of this.
Well, and Anusha, this comes down to trusting the mama gut, right? Like trusting the parent gut. Like if you feel like something is off, again, sleeping more or whatever, just go get it checked out.
Just call at the very least. I've done it 1,000 times and it's always helpful.
Absolutely. Anusha, thank you.